Texas governor gives the okay for some bars to open next week. We're going to get some medical advice on the new plan from Dr. Carlo, a member of the Texas Medical Association COVID-19 Task Force. Good morning to you, Doctor. Thanks for being with us.
Good morning. Thank you for having me.
Okay, so this new order limits bars to resume business at 50% capacity beginning next week in counties that grant permission for it. 50% capacity, bars back open. What are your thoughts?
Well, you know, we know bars are not the safest place to be for preventing coronavirus transmission. Even before we recognized that there was definitely confirmed outbreaks of cases occurring as a result of being in bar settings. It's exactly what we want to prevent, which is staying in confined spaces and not social distancing. So, you know, we know that bars have been a risk area. I'm glad Judge Clay Jenkins has made the decision for Dallas County to not open the bars in Dallas. I think we're still at risk here, and there's just too many cases of coronavirus right now.
All right. So the president said we shouldn't fear coronavirus right now. Does that worry that some people, now we've got bars opening, it's sending a message, at least to some people, that they can let their guard down right now. Are you worried about that?
You know, I am worried about that. In fact, I think we should be doing the exact opposite, especially if we look at where we are right now in the fall season. You know, look, we've just opened up our schools, and, you know, we've got to make sure we can continue to have our school and in-class learning safe. We're about to hit the holiday season, so I, for one, would not want to be a month from now with our case rates going back up like we saw in June and July. I would much rather have where we are right now, heading into the holiday season. So, you know, we've got to look at the calendar. We've got to look at, you know, how we can best make priorities. And I especially want to go back to the schools and making sure that we can keep our schools open.
Yeah, important for a lot of people. Texas is supposed to receive rapid tests that will deliver results in minutes. Have you heard about these tests and when they might arrive? Will that move the state forward? I know there's some doctors' offices that have something like that, right? I mean, is this going to change things?
Well, you know, there's a lot of tests that are out there, and I think that the big thing we've got to all be aware of is that some tests are much better than others. I really worry about the accuracy of some of these point-of-care tests. You know, the last thing we want to do is have someone believe falsely that they are safe with a negative test. In reality, that test was not accurate. We've seen that happen way too many times. So I think the important thing is we've got to make sure that we are practical with when we use the testing, make sure we do the right tests. And I think it has to be under continued advice with a clinician. You know, the test by itself is just not going to give the information we need. You have to have a practical way to analyze those results and make sure you're making the best decision.
Yeah, finally, the World Health Organization says roughly 10% of global population's been infected with coronavirus. I'm assuming we look, you know, like towards the east, we see that New York is starting to see some hot spots again. City of Boston delaying schools. So I'm assuming we look to stuff like that to see what might be headed our way. And that's got to be definitely a concern.
Absolutely. You know, the two things we're looking at is, number one, a 10% rate that the WHO has quoted is way too low for there to be any immunity in the community to really say that we're out of the woods at this at all. And yes, when you look at other areas that have seen recurrences, you know, we were behind New York in terms of their spike. So we've got to watch what those other areas have happened and make sure that we're prepared to account for if we have a similar situation here.
Yeah, makes sense. Makes sense. Thank you, Dr. Carlo. Appreciate it.